Garlic, ginger, and lemon are frequently cited in both traditional medicine and popular health media as natural agents capable of improving cardiovascular health, particularly through claims related to the cleansing of clogged arteries. These assertions are generally based on their anti-inflammatory, antioxidant, and antithrombotic properties. However, from a clinical standpoint, it is essential to differentiate between true plaque regression and modification of atherosclerotic risk factors, as these represent distinct biological outcomes. This video evaluates the cardiovascular effects of garlic, ginger, and lemon using evidence from randomized controlled trials, meta-analyses, and mechanistic studies published over the past 3 decades. The focus is on their influence on lipid metabolism, oxidative stress, endothelial function, inflammation, platelet aggregation, and blood pressure regulation, pathways directly involved in atherosclerotic cardiovascular disease, which remains a leading cause of death among adults over 60. It must be stated clearly at the outset, no dietary intervention has been shown to directly remove established arterial plaque. Atherosclerosis is a chronic inflammatory disease that develops over decades and involves lipid accumulation, immune cell activation, smooth muscle proliferation, and eventual calcification. However, extensive research indicates that certain bioactive compounds can slow plaque progression, stabilize existing plaque, and reduce the likelihood of rupture and thrombosis, which are the primary causes of heart attacks and strokes. Garlic, Allium sativum, is one of the most extensively studied medicinal foods for cardiovascular protection. Its effects are largely attributed to sulfur-containing compounds, particularly allicin, which forms when garlic is crushed or chopped. A landmark meta-analysis published in the Journal of Nutrition, 2001, found that garlic supplementation reduced total cholesterol by approximately 9 to 12% in individuals with elevated baseline levels. More recently, a systematic review and meta-analysis in 2016, Journal of Clinical Lipidology, confirmed that garlic significantly lowers LDL cholesterol while having a modest HDL supportive effect. LDL cholesterol plays a central role in plaque formation by infiltrating damaged arterial walls. Reducing circulating LDL lowers the substrate available for plaque development, which is why even moderate reductions are considered clinically meaningful over time. Beyond cholesterol levels, garlic has been shown to reduce LDL oxidation, a critical driver of atherosclerosis. A controlled trial published in Atherosclerosis, 2006, demonstrated that garlic supplementation significantly decreased markers of oxidized LDL and oxidative stress. Oxidized LDL is far more inflammatory than native LDL and accelerates plaque growth by triggering immune responses within arterial walls. This finding supports the conclusion that garlic contributes to plaque stabilization, not plaque removal. Endothelial dysfunction is an early and reversible stage of cardiovascular disease. A randomized controlled trial published in Nitric Oxide, 2013, showed that garlic supplementation improved flow-mediated dilation, a standard measure of endothelial function, by increasing nitric oxide bioavailability. Improved endothelial performance translates to better arterial flexibility, smoother blood flow, and reduced vascular resistance, factors that are particularly important in older adults with stiffened arteries. Chronic inflammation is now recognized as a core mechanism of atherosclerosis. Laboratory and clinical studies, including a 2015 review in Nutrition Research Reviews, demonstrate that garlic suppresses inflammatory mediators such as TNF-alpha, IL-6, and C-reactive protein CRP, while inhibiting activation of the NF-kappa B inflammatory pathway. Lower inflammatory signaling within arterial walls is associated with reduced plaque vulnerability and a lower risk of sudden plaque rupture. Garlic's antiplatelet activity has been documented in both human and experimental studies. A study published in Prostaglandins, Leukotrienes, and Essential Fatty Acids, 1990, showed that garlic inhibits platelet aggregation by altering thromboxane synthesis. This reduces the likelihood of clot formation within narrowed arteries, an event responsible for most heart attacks and ischemic strokes. Multiple clinical trials have confirmed garlic's ability to lower blood pressure. A meta-analysis published in BMC Cardiovascular Disorders, 2008, reported average reductions of 8 to 9 millimeters of mercury systolic and 6 to 7 millimeters of mercury diastolic in hypertensive individuals. A later systematic review in Integrated Blood Pressure Control, 2015, concluded that garlic's blood pressure lowering effect is comparable to first-line antihypertensive medications in mild hypertension. High blood pressure accelerates arterial damage and plaque formation, making this effect highly relevant for cardiovascular risk reduction. Despite these benefits, garlic does not dissolve plaque or reverse advanced atherosclerosis. Its effects are preventive, cumulative, and supportive, requiring consistent intake over months or years. Raw garlic provides the highest allicin yield, but heat significantly reduces bioavailability. Aged garlic extract, studied extensively in trials such as one published in Phytotherapy Research, 2012, offers standardized dosing with fewer because garlic has blood-thinning properties. Studies and clinical guidelines caution that it may potentiate anticoagulant and antiplatelet medications, including warfarin, aspirin, and clopidogrel. Older adults should consult healthcare providers before using high-dose supplements. In summary, garlic is one of the most thoroughly researched functional foods for cardiovascular health. Evidence from studies published between 1990 and 2020 consistently shows that garlic lowers LDL cholesterol, reduces oxidative and inflammatory stress, improves endothelial function, supports healthy blood pressure, and decreases thrombotic risk. While garlic does not clean arteries in a literal sense, scientific evidence strongly supports its role in slowing atherosclerotic progression and reducing the risk of cardiovascular events. When used appropriately, garlic serves as a biologically active, evidence-based adjunct within a comprehensive heart health strategy aimed at preserving mobility, independence, and longevity in aging populations. 2. Ginger, the anti-inflammatory powerhouse for artery protection. Ginger, Zingiber officinale, is far more than a culinary spice. It is a medicinal rhizome with a long history of use in traditional healing systems and increasing validation in modern cardiovascular research. For older adults concerned about arterial health, circulation, and chronic inflammation, ginger represents a biologically active dietary compound that targets multiple underlying mechanisms of vascular disease. The cardiovascular effects of ginger are primarily attributed to its phenolic bioactive compounds, gingerol, shogal, and paradol, which have been extensively studied for their anti-inflammatory, antioxidant, lipid-modulating, and antithrombotic properties. These compounds interact with several biological pathways involved in atherosclerosis, the progressive process by which arteries narrow and stiffen over time. Chronic low-grade inflammation is now recognized as a central driver of atherosclerotic plaque development. Aging is associated with increased systemic inflammation due to factors such as insulin resistance, oxidative stress, sedentary behavior, and cumulative metabolic damage. This inflammatory state compromises the endothelium, the thin inner lining of blood vessels that regulates vascular tone and permeability. Experimental and clinical evidence shows that ginger suppresses key inflammatory mediators. A review published in the Journal of Medicinal Food, 2011, reported that gingerols and shogales inhibit pro-inflammatory cytokines, including TNF-alpha and interleukin-1 beta, as well as cyclooxygenase 2 COX-2, an enzyme implicated in vascular inflammation and endothelial injury. By reducing inflammatory signaling within blood vessels, ginger helps maintain endothelial integrity and reduces susceptibility to plaque initiation. Oxidative stress plays a critical role in arterial aging and plaque progression. Free radicals promote LDL cholesterol oxidation, which accelerates immune activation within arterial walls. Ginger has demonstrated strong antioxidant capacity in both laboratory and human studies. A study published in Food and Function, 2014, showed that ginger supplementation significantly reduced oxidative stress markers, including malondialdehyde MDA, while increasing endogenous antioxidant enzymes such as superoxide dismutase, SOD. Lower oxidative stress reduces endothelial damage and slows the inflammatory cascade that drives atherosclerosis. Several controlled human studies suggest that ginger favorably influences lipid metabolism. A randomized controlled trial published in Saudi Medical Journal, 2008, found that ginger supplementation significantly reduced LDL cholesterol and triglyceride levels in hyperlipidemic individuals. Similar findings were reported in a 2014 study in the International Journal of Preventive Medicine, which observed improvements in lipid profiles after consistent ginger intake. Lower LDL and triglyceride levels reduce the availability of circulating lipids that contribute to plaque formation, while modest increases in HDL cholesterol, reported in some trials, support reverse cholesterol transport. Ginger also exhibits antiplatelet activity, reducing excessive platelet aggregation that can lead to clot formation within narrowed arteries. A study published in Thrombosis Research, 1997, demonstrated that ginger extract inhibited platelet aggregation by interfering with thromboxane synthesis, a key pathway in clot formation. This effect is clinically relevant because most heart attacks and ischemic strokes occur due to sudden clot formation over existing plaque, rather than gradual arterial narrowing alone. By improving blood rheology and reducing clotting tendency, ginger supports safer blood flow, particularly in individuals with compromised circulation. Hypertension accelerates arterial damage by increasing mechanical stress on vessel walls. Ginger has been shown to support blood pressure regulation through vascular relaxation mechanisms. A study published in the Journal of Nutrition, 2008, reported that ginger compounds act as calcium channel antagonists and enhance nitric oxide-mediated vasodilation, promoting smoother blood flow and reduced vascular resistance. While blood pressure reductions associated with ginger are generally modest, they contribute meaningfully to long-term cardiovascular risk reduction when combined with other lifestyle interventions. Ginger can be consumed fresh, cooked, brewed as tea, or taken as a standardized supplement. Clinical studies typically use doses ranging from 1 to 3 grams per day, which have been shown to be safe and effective in most adults. A warming cup of ginger tea may provide circulation-supportive benefits, especially when combined with complementary ingredients such as lemon or turmeric. However, due to its mild antiplatelet effects, caution is advised for individuals taking anticoagulant or antiplatelet medications. A clinical safety review published in Phytotherapy Research, 2015, recommends medical consultation before high-dose supplementation in older adults or those on blood-thinning therapy. It is essential to maintain realistic expectations. Ginger does not reverse existing plaque or cure cardiovascular disease. Its benefits are preventive and modulatory, requiring consistent intake and functioning best as part of a broader cardiovascular health strategy that includes diet quality, physical activity, sleep, and stress management. In summary, evidence from studies published between 1997 and 2015 supports ginger's role as a multi-targeted cardiovascular supportive food. Ginger reduces vascular inflammation, lowers oxidative stress, improves lipid profiles, inhibits excessive platelet aggregation, supports blood pressure regulation, and enhances circulation. For older adults seeking to preserve arterial health, mobility, and independence, ginger represents a low-cost, evidence-supported dietary addition that addresses the core biological drivers of arterial disease. While not a cure, its consistent use may contribute meaningfully to long-term cardiovascular resilience. 3. Lemon, the vitamin C-rich vascular protector. Lemon, citrus limon, with its bright aroma and refreshing acidity, is more than a flavor enhancer or hydration aid. From a cardiovascular science perspective, lemon provides supportive but clinically relevant vascular protection, particularly through its high vitamin C content and bioactive flavonoids. While lemon does not directly remove or dissolve established arterial plaque, substantial evidence indicates that its nutrients help slow the biological processes that initiate and accelerate plaque formation, especially in aging blood vessels. At the core of lemon's cardiovascular benefit is vitamin C, ascorbic acid, a potent water-soluble antioxidant essential for vascular integrity. One of vitamin C's most critical physiological roles is its involvement in collagen synthesis, the structural protein that maintains arterial strength and elasticity. A review published in the American Journal of Clinical Nutrition, 2001, highlighted vitamin C's essential role in collagen formation and vascular wall maintenance. Age-related declines in collagen production contribute to arterial stiffness and microinjury, creating entry points for LDL cholesterol and inflammatory cells. By supporting collagen synthesis, adequate vitamin C intake helps preserve arterial resilience and reduce susceptibility to plaque initiation. Endothelial dysfunction is an early and reversible step in atherosclerosis. Oxidative stress damages endothelial cells, impairing nitric oxide production and disrupting normal blood flow regulation. Vitamin C has been shown to protect endothelial function by neutralizing free radicals and restoring nitric oxide bioavailability. A randomized controlled trial published in Circulation, 1999, demonstrated that vitamin C supplementation significantly improved endothelium-dependent vasodilation in patients with cardiovascular risk factors. Similar findings were confirmed in a 2004 study in the Journal of the American College of Cardiology, which showed that vitamin C acutely improves endothelial function by reducing oxidative inactivation of nitric oxide. These findings support lemon's role in maintaining a healthier vascular environment rather than reversing existing plaque. LDL cholesterol becomes particularly atherogenic once oxidized. Oxidized LDL promotes inflammation, immune cell recruitment, and plaque growth. Vitamin C has been shown to inhibit LDL oxidation, thereby slowing one of the most damaging steps in atherosclerosis. A controlled human study published in the American Journal of Clinical Nutrition, 1997, found that vitamin C supplementation significantly reduced circulating markers of oxidized LDL. By slowing LDL oxidation, lemon helps reduce cholesterol-driven inflammation inside artery walls. Beyond vitamin C, lemons are rich in citrus flavonoids, particularly hesperidin and diosmin, which have been studied for their vascular protective effects. These compounds exhibit anti-inflammatory, antioxidant, and vasodilatory properties. A review published in the Journal of Nutrition, 2010, reported that citrus flavonoids improve endothelial function, reduce inflammatory markers, and enhance capillary strength. Additionally, a clinical study in phytotherapy research, 2012, found that hesperidin supplementation improved vascular reactivity and reduced markers of oxidative stress in individuals with cardiovascular risk factors. These effects contribute to healthier blood pressure regulation and reduced mechanical stress on arterial walls, an important consideration as hypertension accelerates plaque progression. Although lemon itself is not an antihypertensive agent, its vitamin C and flavonoids contribute to improved vascular tone. A meta-analysis published in the American Journal of Clinical Nutrition, 2012, concluded that vitamin C supplementation was associated with modest but statistically significant reductions in both systolic and diastolic blood pressure. Lower blood pressure reduces cumulative arterial injury over time, indirectly slowing the progression of atherosclerosis. Lemon also supports cardiovascular health indirectly by encouraging adequate hydration. Proper hydration reduces blood viscosity, improving circulation and decreasing cardiac workload. This effect is especially relevant in older adults, who often experience diminished thirst perception. While hydration itself is not plaque-modifying, improved blood rheology reduces circulatory strain and supports overall vascular efficiency. Lemon is easily incorporated into daily routines through diluted lemon water, salad dressings, or as a seasoning for fish and vegetables. However, due to its acidity, excessive or undiluted consumption may erode tooth enamel. Dental guidelines, including those summarized in a 2014 review in General Dentistry, recommend dilution, straw use, and post-consumption rinsing to minimize enamel damage. Individuals with gastroesophageal reflux disease, GERD, may need to limit intake or consume lemon with meals rather than on an empty stomach. It is important to maintain realistic expectations. Lemon does not reverse arterial plaque or treat cardiovascular disease independently. Its effects are preventive and supportive, functioning best as part of a broader cardiovascular health strategy. In summary, evidence from studies published between 1997 and 2012 supports lemon's role as a vitamin C-rich vascular protector. Lemon contributes to arterial health by supporting collagen synthesis, reducing oxidative stress, inhibiting LDL oxidation, improving endothelial function, and aiding blood pressure regulation. While lemon does not clean arteries in a literal sense, it strengthens the biological defenses that protect arteries from progressive damage. When combined with proven strategies such as fiber-rich nutrition, regular physical activity, stress management, adequate sleep, and complementary foods like garlic and ginger, Lemon serves as a daily protective shield for long-term cardiovascular health. Think of lemon not as a plaque remover, but as a quiet reinforcer of vascular resilience. One sip at a time. Incorporating garlic, ginger, and lemon into daily routines can be a meaningful step towards supporting arterial health when these foods are embedded within a comprehensive, heart-supportive lifestyle. Research consistently shows that individual foods exert their greatest cardiovascular benefit when consumed as part of an overall dietary pattern rather than in isolation. Large population studies, including the PRIDIME trial, New England Journal of Medicine, 2013, demonstrate that diets rich in fruits, vegetables, whole grains, legumes, nuts, olive oil, and fish significantly reduce the risk of cardiovascular events by improving lipid profiles, lowering inflammation, and enhancing endothelial function. This type of dietary pattern provides dietary fiber, polyphenol, antioxidants, and healthy fats that collectively reduce LDL cholesterol, inhibit oxidative stress, and support long-term vascular health. Garlic, ginger, and lemon function synergistically within this nutritional framework by targeting inflammation, oxidative damage, and blood flow regulation. When this nutritional foundation is combined with regular physical activity, cardiovascular benefits are further amplified. A systematic review published in Circulation, 2015, confirmed that moderate physical activity, such as walking, swimming, or light resistance training, improves endothelial function, increases nitric oxide availability, enhances insulin sensitivity, and reduces systemic inflammation. These effects help preserve arterial flexibility and slow age-related vascular stiffening. Stress management and sleep quality also play a critical role in arterial health. Chronic psychological stress elevates cortisol and sympathetic nervous system activity, both of which contribute to endothelial dysfunction and accelerated plaque formation. A review published in The Lancet, 2018, linked chronic stress and poor sleep duration with increased cardiovascular risk through inflammatory and hormonal pathways. Mindfulness practices, adequate sleep, and relaxation techniques have been shown to reduce inflammatory markers and improve vascular function over time. Avoidance of harmful lifestyle factors significantly enhances the protective effects of heart-healthy foods. Extensive evidence, including reports from the U.S. Surgeon General, 2014, and a meta-analysis in the BMJ, 2017, confirms that smoking and excessive alcohol consumption directly damage the endothelium, increase oxidative stress, and accelerate atherosclerosis. Eliminating these risk factors dramatically improves the effectiveness of dietary and lifestyle interventions. While garlic, ginger, and lemon are generally safe and well tolerated, they should be viewed as adjuncts to cardiovascular care rather than substitutes for medical treatment. Clinical guidance emphasizes caution in individuals with established cardiovascular disease, diabetes, kidney disorders, or those taking medications. Reviews published in Phytotherapy Research, 2015, and the Journal of Clinical Pharmacology, 2016, highlight that garlic and ginger, in particular, may potentiate the effects of anticoagulant, antiplatelet, or antihypertensive medications, underscoring the importance of medical consultation before using concentrated supplements. In summary, evidence from studies published between 2010 and 2018 supports the role of garlic, ginger, and lemon as scientifically grounded allies in cardiovascular prevention. These foods help reduce inflammation, improve cholesterol balance, protect endothelial function, and promote healthier circulation. However, their true effectiveness lies in consistent, long-term use within a holistic lifestyle approach that prioritizes nutrition quality, movement, stress control, and medical oversight. There are no shortcuts or miracle cures for arterial health, but informed, evidence-based daily choices, repeated over time, can profoundly influence cardiovascular aging. If you found this video helpful, please like, share, and subscribe to Healthy Life for more science-based guidance on natural health and heart wellness, especially designed for adults over 50. Your heart works hard for you every day. Let's give it the informed, natural support it truly deserves.